Golfers, are you held back by nagging knee pain? It's not just discomfort. This is limiting your swing, your power, and consistency. Today, I'm joined by Lauren Mueller, PT, DPT. Lauren is a TPI certified instructor, a physical therapist, and she helps golfers move better, swing smoother, and play pain-free. Today, we're going to break down how your body's limitations impact your game and how a combination of physical therapy, targeted and cutting-edge regenerative treatments can get you back on the course faster and stronger. Whether you're a weekend golfer or a serious player, this is a game changer. Let's dive in. First, welcome, Lauren. It is a pleasure to have you on the podcast. I have been thinking about this episode for quite some time because you know golfers, I know golfers. I think it's going to be a perfect combination where they can see how these two things come together and keep people back on the course. I mean, right now is prime golf season. So please introduce yourself to everybody. Tell us kind of your background, what your passions are, and then we'll dive into some topics.
Yeah, thank you so much, Dr. Penhollow, for having me. Like you said, I'm Dr. Lauren Mueller. I'm a physical therapist here in the Valley, Phoenix, Arizona, Paradise Valley area, and I have been a PT, practicing PT for about 10 years now. I went to school here down at U of A for undergrad. I went to NAU for their PT graduate program, and I am super passionate about golf. I've grown up golfing, and I decided that's going to be a passion of mine to bring into my clinic and gym as well. So I've gotten TPI certified, which is through the Titleist Performance Institute, and that just helps me understand personally my swing a little bit better, but also helps me understand how the swing affects the body physiologically, kinetically, and how we can kind of help use those different cues to break it down and figure out the best pathway to healing for you is. So that's one of my golf focused and passions that I like to combine together.
Wonderful. Thank you for explaining what TPI is. And I know that people who play well know Titleist, they know all about instructors, and they seek that out. So I know this creates quite a special niche for you. You have active golfers that are in an acute, probably maintenance, and maybe more of they just kind of call you up when things happen, nagging injury type of thing. So kind of paint the story. If somebody does play golf and they specifically want somebody to help them with their golf game, tell me what it would entail.
What it looks like. So being in Phoenix, Arizona, we have beautiful weather most of the time of the year, but that means I have clients who fly in just for temporary visits, whether it's just a short-term stay, they're here for a month, maybe 6 months, kind of depending on what that looks like. Or I have my year-round clients that I see all year round. What that looks like for my treatment, it depends on if we are an acute injury. Hey, I have a torn meniscus, whether I have been coming off of a knee replacement, whether we're talking about knees today here. So I'm kind of focusing on that. Yes, there's a lot of back pain with golfers, but today we're going to really focus on knees. So I'll have clients who are dealing with sharpshooting actual pain that I really like to focus on, calming that down, strengthening them through the program and making sure that they're strong enough on the other side and not actually having to continue to play with that pain. So that progression is super important, especially here at Streamline. We like to focus on not just getting you pain-free, but keeping you pain-free so that you can keep enjoying your hobbies for as long as possible. So with golfers, I see you guys as the season starts picking up and the weather gets really nice, that we start ramping up on how often everybody's being able to get out there a little bit more. So a lot more injuries come at the end of December, January, February, at this prime time of the year. It could be anything all over. So I hope I was answering your question right. But the clients can be maintenance program. I have a lot of clients who specifically are golfers who come in once a month. They come in, they keep their body, they want to make sure that they are maintaining proper body work, keeping their mechanics right, making sure that they know how to, if you guys have gone down the TPI world, you know how to work your upper body completely different than your lower body, as well as like being able to control the various dynamics with a swing, keeping the lower body strong, as well as engaging your upper body. So we have a lot of maintenance clients, a lot of pain clients, and a lot of kind of right in between. Hey, I've had this chronic thing going on. It's kind of flaring up right now. We work on trying to get through that. And those clients are really great clients. I like to share with Dr. Penhollow because she can help with some of that regenerative medicine there as well. So
thanks for breaking down the kind of the life cycle of the patient as they work. And a few times you mentioned maintenance. We also talk about prevention so that they don't get injured. They've already had that injury. So a lot of it is focusing on the core, focusing on the upper body as well as the lower body. It's so hard to just say that if you've got a knee injury, that it's just going to focus that. We've got to look at the whole kinetic chain. I've mentioned the kinetic chain before, but let's say a person has, during their swing, they just go to kill the ball on a drive. They've planted that foot. It's a planted twisting injury. They feel a posterior pull. We're suspecting that there's some kind of a soft tissue injury. What type of things are you going to do at the initial consultation and kind of set that through with all the way into getting them back on the course?
Yes, I just had someone like this come in 2 weeks ago, unfortunately. Usually that presents fairly similar to a meniscus injury. If you have any sort of rotation injury, that's what I see most often. You can, anytime there is an acute injury, I break things down to my clients. I really like to dumb it down because I don't expect anybody to know. We dumb it down to we've got muscles and we've got bones. We're going to start that low. Muscles are our blood pumps. They are strength. They're endurance. They keep us going. Bones are our structure. So things that really help with that to kind of help keep people in mind. Ligaments and then tendons are two other scary things that people hear about. So ligaments are what we have that keep bones together. So those are also structure. Those are not going to be damaged unless you have some sort of trauma or injury along those lines. So I have somebody coming in and they said, ow, I heard it pop. I did this. It now hurts. It's usually swelling. That tells me it's more of a ligament or meniscus injury. Something happened acutely. You're getting something that's injured. And then you have tendons. Tendons are what connect muscles to bone. And so that works a lot on actual movement over use. So that's my client who, hey, I haven't been golfing because I've been stuck in really crappy winter weather. I'm now just moved back here to Arizona for a couple of weeks and I started ramping things up. And now I'm having issues. So that tells me it's a little bit more of an overuse injury. It's something that has kind of slowly ramped up. That's going to lean me into the tendon world or more muscular world versus I know that we're going to have either a direct meniscus or we're going to have an acute ligament injury, stuff like that. So when I have somebody come in, I always explain that. I know it seems simple and anatomy 101, but I think that's important for people to understand. And then that's kind of what guides my treatment from there. If it's going to be an acute injury with, let's say, a meniscus tear, most importantly, you want to work on reducing the pain. So first of all, we say, all right, what do we got? Do we have to do some sort of like effleurage? Are we doing some soft tissue mobilization or deep tissue massage? What I can do there. I have a lot of tools in my toolbox that I like to use, whether it's dry needling, which is a type of acupuncture that goes into the actual muscle or tendons that are inflamed surrounding that area. That can kind of help increase that purposeful trauma and get a good inflammation response to help flush that out. We do cupping, which has been really helpful, especially if you have some of that really acute swelling there or that muscle tension that just goes with the guarding of a new injury. I have a really awesome device called the Shockwave, which I'm sure maybe Dr. Penhollow has gone into what shockwave therapy is before in previous podcasts, but that's been a like close to a magic button tool that I love to use. And then I do, if it's an issue and I know, hey, some people really want that peace of mind, they want an MRI, that want a diagnostic, I always encourage that. That's not going to change my treatment plan. I just want to make sure that we are treating what they want to be treated and kind of being able to build up from there. And then when you have a traumatic injury like that, the most important thing that you can do is keep the muscles surrounding that injury really strong, because a lot of what you hear is just rest, give it a rest for like 4 to 6 weeks. In my mind, that's the worst thing that you can do, because I really want to make sure that you guys can keep that muscle pumping and like keep your body strong. You're going to atrophy if you don't do that. And then after that 4 to 6 weeks, you're like, oh, I'm not feeling so bad. You're going to go out there and it's going to be atrophied. It's going to be painful and it's just not going to be what you want. So those are some of my first attempts of what I would kind of do with that.
Wonderful. And the fact that we talk about, it used to be rest, ice, compression, elevation, the whole rice thing.
Mm-hmm.
Really, it's not like you want to go out and play 27 holes on it the next day. There is that form of rest, but it's not laying around, because we now know about sarcopenia. And even in the most well-conditioned athlete, that after 5 days of no activity, we've already got a significant amount of muscle loss. So thank you for touching on that. Can we also talk about, say, that it's a injury, same injury, maybe the meniscus tear, but it is a degenerative one? It's because the person has a degree of, it could be a 2, it could be a 3, it could be a 4 in terms of the grade of osteoarthritis. Do you treat that any differently?
The answer that I used to hate all my professors giving me was it depends, but it does very much depend on the client, the population, and you said the severity of that injury. Osteoarthritis is unfortunately extremely common, especially if you have had previous knee injuries in the past or even surgeries. That's more likely to lead to an advanced stage of osteoarthritis. Arthritis does not necessarily mean that you need to have a knee replacement immediately. There is cases there, I think it could be very beneficial and could be helpful. There are cases where people just don't want to commit to that right away. And I think there's a lot of preventative care that you can do on that side as well. I'm sure Dr. Penhollow, you can talk on injections or different types of like more conservative aspects of treatment. For me, I look at that is if you're going to be bone on bone, which we hear all the time, what keeps us from being bone on bone is that muscular system that supports it. So when I see somebody who says, I'm super bone on bone, how do we unload that? If we teach you how to properly engage your quads, your hamstrings, your glutes, your hips, your calves, you support every muscle surrounding that knee joint, you're going to have a lot less of that like deep compression, aching pain, and you're going to know how to use your body a little bit better out on the course, out on the field, or out on whatever you may be trying to do out there. So I really encourage a general strengthening program, whether it's before or during or after you do that knee replacement for me.
Absolutely. Thanks for touching on that. And notice that you said the muscles above and the muscles below. We talked about the calf, we talked about the hams and the quads. So that's fantastic. So we kind of dove into the accommodations post-injury that we're talking about strengthening. We're talking about removing the inflammation, whether that be the effleurage, which is kind of the milking of the lymphatic system, and maybe the special techniques you have. Let's talk about specifically the accommodations post-operatively. So I want to have two different things. One is somebody came in, they had maybe a meniscal repair or they had an ACL repair. They've got these specific restrictions from their orthopod. And then after we do that, let's talk about the person after a TK or a total knee replacement. We can then extrapolate to total hip replacement and to spinal fusion because we're going to marry that up in the kinetic chain. So let's go with
Perfect.
it's something that's not, they don't have hardware yet, or they might have a screw or they might have some cadaver into where the ACL is or whatever. Tell me about the accommodations you make for a golfer who wants to get back on the course after they've had something like that.
Yeah, so golfing is a lot of rotation on whether it's your lead leg or whether it's on the back leg. You do have a lot of compression, rotation, and like as you're pulling through in your hips, you just need to be able to understand what that's going to look like, what that shearing is going to look like on the joint. A lot of it is from glute strength. And then people always forget it's not necessarily just always about the swing. It's about bending over and getting your golf ball or lining it up when you're putting. That is something I have a lot of golfers complain about because they might be able to piecemeal together some sort of swing that might not be my personal favorite, but bending over at the end on the green and trying to line up the ball, lining up their putts, that's when they're trying to get in that deep knee flexion and kind of assessing what their putting line is going to look like. So that's also super important. I always like to touch on that because that once we get to knee replacements, you got to get that deep knee flexion back in there. So let's take it in my mind as something as simple is a meniscus. Yes, there is a variation of different types of meniscus repairs that you need to look at, but most likely that's going to be your least invasive knee surgery that you may have. Some of it might be arthroscopic, some of it might be a little bit more invasive, but still it's not going to require as long of a rehab journey. I just had a gal who was here, just had a meniscus repair. Her goal was to be able to walk the waste management because she volunteers and is a sign holder for the waste management every year for the different golfers. And so she is a personal golfer and she also is a fan of golf. So she needed to be able to walk 18. And I know I did it that this year and I followed a golfer who was a friend playing and I walked over 14 miles. So you've got to be ready to rock with that. So with her, a lot of it's first of all, you need to get your range of motion back. This is generally for any knee injury that I'm going to look at post-operatively. You need to make sure that you can get that full knee flexion, full knee extension. You're going to have a lot more limited knee flexion when you have a total knee replacement, but you can get past that 120 depending on who your surgeon was, how hard you're working, what your pain scales look like. So that's going to be your first thing. Next thing is you really need to learn on, like, get back to knowing how to balance, knowing how to step, knowing how to not be scared of different movements, single planar, multi-planar, kind of transitioning into that. I really like to dumb it down, make sure everybody understands lower muscles, upper muscles, anterior muscles, posterior muscles, all these things I really want you guys to focus on. So if I have a client and they're like, so tell me what I need to do. I've given them 1,000 exercises, but at the end of the day, I need you to know as long as you're working your quads that are on the front, your glutes that are on your booty, your hamstrings that are on the back, you're working your calves and even that anterior tip and finding the balance in between your feet. If you're focusing on something like that, you're going to be helping set yourself forward. But finding a progression of what your knee can tolerate is going to be really important. So that's kind of a general and meniscus. You just work on strength. I love to use, I have all different tools in my toolbox. I love the blood flow restriction, which is great. You're able to work on strengthening your muscles a whole lot faster with less tension and with less weight bearing and with less loading. That's going to help you increase that muscle mass a lot faster. And the ACL is a whole other journey. That, respectfully, I think requires about a year. And a lot of professional athletes and a lot of doctors will just say it's anywhere between 4 to 9 months. I really do truly think that it is more of a 12 to 14-month recovery. I think it's just so important to make sure that you are testing and understanding what it looks like when you're recovering from a ligament injury. That is just a whole lot more intense. And I can have an entire 3 hours talking about that. But I would really make sure if you're in my ACL recovery phase, we need to demonstrate equality between your affected limb and your non-affected limb up to about 80% before I'm going to let you go rotate and whack the ball out on the driving range or even on the course. So ACL is a little bit more intense. I just want to make sure that we aren't doing anything wrong there. And then if we have a total knee injury, a total knee replacement, that is very common, especially out here in Phoenix and Scottsdale area. It is very painful up front, but the recovery is worth it. And everybody is so grateful that they've done it once they've done it. The walking is better. You're able to walk 18. You're able to go up and down hills, really focusing on balance, really understanding rotational strength is going to be really important. Being able to load the glute and loading the hip is really important. That's going to be something that long-term is going to affect your golf swing anyways. If you have a stronger glute and stronger hip, you're going to have further power, and that's going to drive your ball farther if you're able to start using that better. So I really want to make sure that with that total knee replacement, that clients are understanding that yes, it's a journey. It's first things first, getting range of motion back. While we're doing that, we're also building our third strength and then making sure that our balance stays there. Because when we have a total knee replacement, you're taking your bone away from your bones. You need to relearn how to balance on that. You need to relearn what your proprioception looks like. And then, like I was kind of talking about, I need you to get that deep knee flexion so that you can get down on there and you can start setting your ball, understanding where it's going to be on your putt, and you can kind of line that up a little bit better. So range of motion is huge. Strength is so important. That is something that we really like to hammer here at Streamline, but keeping you strong and ready and prepared. And then a lot of times is, yes, you might be feeling great. It's like, okay, let's not go hit at 18. Let's start on the driving range. Let's not hit a large bucket. Let's hit a smaller, medium bucket. And then we'll see how it feels. Like if you're going to go out there and hit a large bucket, 10, like, I don't know, it's about 100 balls. You're not hitting 100 balls, even on 18. Hopefully you're not. But some of us are. So you just need to understand like the repetition and how much that really is going to be. So learning what that looks like, understanding I'm going to give you an inch. Don't take a whole football field. Just know that there is a gradual process to getting back and healing. And that's going to be something that will help get you back out there faster. So I hope I went through some of those. Spinal fusion is going to be a little bit different, and a total hip work back up. You got total hip. Those repairs, shockingly, a whole lot easier than a total knee. My clients love them. They hate them not leading up to it, but at the end of the day, they're like, wow, that really helped. My mother-in-law was playing Pilates. Gosh, she's back doing Pilates in 4 weeks. So if you have a total hip and you know what you're doing, I personally think PT really helps speed that up. But knowing how to really load your glute, get stronger in that posterior chain is going to be beneficial for you. And then a spinal fusion, also fairly common with golf. You get a lot of rotation. So if we want to dive into the back world, I really can. But a lot of what happens is if you need a spinal fusion, most often you probably don't have enough movement in your upper thoracic spine. So in your upper back, you're probably rotating down at that lower lumbar area. And if you are a golfer, you are rotating a ton. Like I said, let's just give the average golfer about 100 swings. And if you're doing that 100 times, what else do you do 100 times a day? That's kind of a lot of load, and you're adding various points of impact on that. So your body needs to understand how strong your core is on that, how strong your glutes are on that, how strong all your back muscles are, how strong your posture is. But you need to have proper range of motion, like I say, in your upper thoracic spine, in your mid thoracic spine, and in that low lumbar. So keeping your hips with good mobility, keeping your low back with good mobility, but also really focusing on that upper thoracic is super important as I have clients get back into the golfing world. But with that, dynamic core strength is so important. Even if you're just a meniscus athlete, Your core strength is so, so, so important. And there's a lot of studies that go into the benefits of core strengthening. I wouldn't do this, but if you just solely strengthen the core, the outcomes of how your knees have improved. So I correlate that with lower leg strengthening and core strengthening, and that will get you what I think the magic sauce is, getting better faster.
Oh, it is. I've heard you talk about core stability. I've heard you talking about the posterior chain and the anterior chain and even the thoracics all the way through. In the ideal world, that buzzword that I love, prehab. If somebody knows that they're getting ready to have a knee replacement or that they are heading down that spinal fusion pathway, isn't the ideal time to see you, well, before the injury happened, but the ideal time to see you is actually to do some prehab before even the surgery.
Yeah, I think I like to speak on like any point of phase that you are. If you're open to making sure that your body knows what's coming up is going to be the most important thing. So you can, if you know you're going to have surgery coming down the lines, teaching somebody what they need to do when they're at home post-operatively before they even have, like, I'm in pain, I don't feel great, I don't go to PT for 2 weeks until, what do I do in that period of time? That is this kind of like purgatory. I don't know. Can I do anything? Can I not do anything? A lot of my clients are just like, they get so nervous. So in prehab, not only are we working on strengthening and showing you what you can do right after that surgery, it could also be like, let's talk through this. What does your house look like? What are going to be some of your different obstacles that you have at home? Whether it's, are you living alone and are you single and do you need to meal prep some stuff? Do you have like, what is it going to look like if you're going to need a shower after you have a knee replacement? What, like, are you able to get in and out of those bathtubs? Is it upstairs? Is it downstairs? Like a lot of those conversations that feel hard, I have in those like 2 sessions right before you actually have that surgery. But leading up to that, we've made sure that you know how to engage your glutes appropriately. You know, a couple exercises that are safe to do in your home. You learn some great stuff that you can do to avoid having surgery. So a lot of clients are like, oh, maybe this is prehab. They're like, I'm doing great. Actually, I really just needed to learn how to rotate my upper thoracic spine a whole lot more. Now my low back has no pain and I've been feeling great. And I'll have clients who, fortunately, I get to do that. And that's awesome. Most of my clients don't need surgery. So there's always the people who do. And that's been something that's either advanced arthritis or some severe disc herniation stuff. But there's a lot of things that you can do, whether it is preventative for people who are just like, you know what, something's not right, I want to learn. And that feels, I think, like a majority of my clients, they're scared of what could happen down the road. They want to make sure that they're staying a little bit more proactive about it. They don't want to have a spinal fusion. They don't want a hip replacement. And they learn how to actually incorporate strength training and movement and mobility. And that's going to be kind of the ticket to prolonging that and keeping that game right. And who doesn't want a little body work every once a month either? That also feels pretty good. Soft tissue wise, whether it's something as simple as like cupping and just movements or new stretches. It's not always just an exercise. Sometimes your body needs a little bit of like, oh my gosh, my muscles have been so tight this way. My lower QL, because I'm swinging and I'm right-handed, my left side is just grumpy and tight. Maybe we need to work on a little bit more muscular balance. That way you're not overusing that injury and you're going to start hurting your low back. So I do a lot of that too.
That's wonderful. A lot of stuff that hopefully keeps them out of the operating room, but then you know that if they do go to the OR, that there's going to be a plan post-operatively too. I love that. So we've talked about post-injury, post-fusion, post-replacement, either the hip or the knee. Can you just break it down? Because we've been ignoring the elephant in the room. Yes, I wanted to focus on knee because so many people are knee, but it all stems from the ground all the way up. So when you're working with somebody, do you actually take them out on the course and analyze their swing? And you talk about, wow, your ankle, you got flat feet. Oh, your knee, you're not rotating. Or I see that you got atrophy of the inside of your knee and no wonder the inside of your knee hurts. Tell me kind of what you do, particularly with a golfer that's going to address this entire from the ground up thing.
Yes. Thank you for asking that. Yeah, absolutely. I have gone to the range and I have watched people swings. I am not a swing coach. I like to tell people that. So don't come to me asking me to get better. I'll just make you feel better and then you can swing better after that. But it is so important. Yes, your feet are a huge component of your lower kinetic chain. Absolutely. You have a drop. That's going to put a lot more pressure. I tell people, like, if you're sitting at home, you're listening to this, you're watching this, let your feet be lazy. What happens when you let those feet be lazy? Your knees come in. And when those knees come in, you're going to put a whole lot more pressure on that medial aspect of your knee. And you're going to find out, oh my gosh, my butt's not really turned on. I don't have any glute med. It's not activated, right? Okay. let's try to make those feet be really strong. Push down through your toes, pull your knees out, and engage your outer hips. And you're like, whoa, I can actually feel those muscles. So I tell it, it's like my feet are lazy, they're rotating in. Let's try to make them strong. Let's pull those muscles and use them out. And it's just learning what that looks like. If it is a ankle issue, you have to look at everything. You break down, and that's kind of what the TPI teaches you. I'm a physical therapist, and that's kind of what I've been doing anyways. I have a shoulder problem. Like, is it just your shoulder? Do I look at your neck? You kind of have to look at everything. So if it's a knee problem, it could either be coming from your low back for sure. It could be coming from your hip for sure. It could be coming from your ankles for sure. It could be coming from the arch of your feet for sure. It could just be a knee problem. It could be any of these things. So you have to make sure that you understand what exactly it's coming from. If you had an acute injury, we're going to focus on the acute injury, and then we're going to assess why we had that acute injury. Was it because our glute's weak and we are throwing a force on that and that's not able to withstand that along your knee? Or do we have insoles that we've had insoles in for the last 15 years because someone 15 years ago told you that's it and you haven't changed them? We might need to reassess that. We might need to see what's going on. We might need to see if that is the appropriate insole for you anymore, or if it's more of just a strength awareness. What I learned, we have a lot of motor morons out there, and that's okay. It's just not knowing how to turn on the appropriate muscles that you need when you're looking at that. When you're going through a golf swing, you're focused on just hitting the ball. Great, that's the first thing. But there's also a lot of other things that you know focus on. Is your core engaged? Are you using your glute? Are you rotating all the way through? Is your toe pivoting? Like, where are we in the golf swing analysis? And that's just in the golfer's world, but any kind of exercise that you're out there doing. Yeah, you're doing crunches, but are you actually using your core when you're doing those crunches? You're doing a bicep curl. Are you focused on using your bicep when you're doing your bicep curl? Or are you just kind of going through the motions? So if we're using momentum and going through the motions when we exercise, that's going to be a whole lot more detrimental than if you're more intentional about your exercise and you're going to really kind of keep that area of focus going. So like you said, the whole kinetic chain is so important. If I see knee pain, I know there's usually a hip issue, and that's just usually a lot of glute weakness, glute med weakness, hip adductor weakness. So we hammer some glutes. We also make sure people's balance. When we work on balance, we're really working on your foot intrinsic, so you understand what muscles need to be focused when we're in weight bearing on just one leg and weight bearing on two legs, 1.5 as we're in like a transitional swing. It's just really important to understand what each muscle is doing and what your body is doing in a dynamic movement. So like a golf swing. Those are, yes, very important. Look at the whole body.
Absolutely. So people don't think I'm crazy. This is now the second time you've heard that when you come in for your knee, your back's going to be looked at.
Yes. I can also,
I absolutely
definitely. The spine is so important. And so often people will have lateral like calf pain and they're like, oh, my knee's been killing me. And it's like, I can guarantee that's your low back, but we can go through the motions. I'll look at your knee, but I'm going to definitely assess your back. Anything that you have going down, and like, it's just like your shoulder. I'm going to look at your neck because your shoulder's below your neck. I'm going to look at your hips. I'm going to look at your knees. I'm going to look at your feet. I'm also going to look at your back just to make sure that we can make sure that we're not having any radicular issues. Maybe we're not having any sort of disc pathologies or lumbar impingements, anything along those lines, because that can be sending referral pain or radicular pain down your legs and knees as well. So very much always look at your back.
Good. Excellent. What do you think we've missed? What do you think we haven't touched on here? Because I'm super excited for people who golf just to kind of get that idea of this is what I can do preemptive strike. This is what I do if I do get injured and it's not a big injury. This is what I do if I get so injured that I'm going to have surgery that all is not lost. I can get back on the course. What else do we need to talk about?
I think we've covered a lot. I mean, I could talk a whole lot more about how shoulders involved with golf. I can talk a whole lot more about how back's involved in golf. But I think if you're not sure, if you feel like your body has some sort of limitation, you're like, oh my gosh, I don't know why I'm not getting enough power. Is it because you don't have enough rotation in your body? Is it because you have a shoulder range of motion restriction? Is it because our hips aren't moving as much? Like, there are different assessments that you can do. I'll do a TPI assessment when clients come in and make sure that their ankles are moving right, their hips are moving right, their core's stable enough and strong enough, they have enough quad stability and glute stability. Make sure that your lumbar rotation is good, make sure you're not over rotating there, and like you just work your way all the way up the chain. And that's something that I think is really important. If you're like, hey, how is my body working? Have somebody look at it. They can assess, they can make sure that they know, or they can guide you in a couple of movements, stretches, exercises, mobilities, things that can kind of unlock that game for you. Also, warm up before you golf, please. You're about to go do an activity for 4 hours. Please just try to do a little bit of it, something active, warm up, rotate your spine, get your glutes involved, use your core. Please do that. That's something I don't think is harped on enough.
No, it's not. A lot of people go out cold, or they'll just do a static stretch without a dynamic warm up. And so we talk about walking with the high knees, lifting those knees, and then maybe do the stretch or whatever it is. Swing the arms like a windmill, then do the stretch. Something like that. Get the blood pumping first. Yeah, I think it's really motivational for people to say, wouldn't it be nice if I can do this preemptively? If I can have my swing analyzed before I even go out there, because then 2 months later, when I've been playing 2 or 3 times a week and I've got this nagging shoulder injury or my knee is now hurting, wouldn't it have been nice to notice that I could have probably prevented this if we'd caught it early because my mechanics weren't right?
Yeah, absolutely. There's something as simple as, hey, we don't have, our time doesn't align. Videotape it. Have the partner you're golfing with videotape it. Do it from the back, do it from the front, do it from the side. See, don't do it from the front. Don't do it from in front of the swing, but just make sure that you're able to assess it in different ways and we can go over it together. I see golf swings all the time. Like, yes, we are coming out of our swing a little early. That's going to put a whole lot more compression on that low lumbar spine. Let's talk about how we can adjust that. Why are you doing that? So definitely, I would say that's something that you can do.
Wonderful. How do people find you? How do people work with you? Go ahead and let us know. And we'll also put it down in the show notes. You don't have to have a pen and paper if you're driving right now, but it'll all be there and we'll link to that. But please, how can we work with you?
Again, my name's Lauren Mueller from Streamline Performance Physical Therapy. We are over up in Paradise Valley, over off Cactus and Paradise Valley Parkway near Tatum and Cactus. Feel free to give us a phone call. Feel free to find us on Instagram, Streamline. Feel free to give me an email. Brittany is our front office manager and she is awesome. She will kind of help guide you. You can ask for me, but I also have 3 other physical therapists that I work with and they are amazing. So Ryan is great, Nick is great, and Krista is fantastic. So there's 4 physical therapists here and we really love working with golfers, active people, and we can't wait to be able to help you figure out how you can help yourself.
Wonderful. Thank you so much, Lauren. It has been a true pleasure, and I look forward to a continued working relationship with you and your team.
Yes, absolutely. Thank you so much, Dr. Penhollow.
Thank you.
If you have knee pain and would like to learn more, I have a worksheet called 5 Things to Do Now to Reduce Your Knee Pain Within a Week. Go to www.kneeboostnow.com to download it for free. I'd love to hear from you, so please like, subscribe, and comment below so I can help you get out of your knee pain.